Hello, I'm Dr. Greg Cascino. I'm a consultant in the Department of Neurology at Mayo Clinic in Rochester, Minnesota. I'm also chair of the Division of Epilepsy. The topic for discussion today is, I have been diagnosed with epilepsy. What are my options? Epilepsy is one of the most common chronic neurologic disorders. Perhaps 3 million Americans have a seizure disorder or epilepsy. Nearly 10% of Americans may have one or more seizures during their lifetime. Every 4 minutes, an individual is diagnosed with epilepsy in the United States, and perhaps 1 in 26 Americans during their lifetime will have a seizure disorder. Typically, the diagnosis of epilepsy or a seizure disorder is the presence of 2 or more recurrent unprovoked seizures. The majority of the patients with epilepsy may be rendered seizure-free and live normal, productive lives. The goals of the evaluation and treatment of epilepsy are to render the individual seizure-free, to avoid any adverse effect associated with treatment, and to allow the patient to become a participating and productive member of our society. Typically, an important issue in the adult patient is the opportunity to legally and medically be able to operate a motor vehicle safely. Importantly, patients with epilepsy will need a neurologic evaluation. This will typically begin with an office visit for a neurological history and examination. The physician will attempt to determine the etiology or cause of the seizure disorder. Importantly, seizure precipitating factors such as sleep deprivation, excess alcohol use, and anti-epileptic drug noncompliance need to be identified, as this may increase the tendency for seizure activity. Most individuals who are adult patients with new onset seizure disorders will undergo a neurologic evaluation, which will include an outpatient EEG recording and an MRI head. The rationale for the EEG recording is to classify the type of seizure disorder the patient may have. This may be important initially to identify the appropriate anti-epileptic drug medication. The purpose of the MRI head is to identify any pathologic substrate, that is, structural abnormality, that may be associated with the seizure disorder. Subsequent to the initial diagnostic evaluation, the physician will decide if the patient is a candidate for anti-epileptic drug medication. Selected patients may be observed off seizure medications if it is felt the patient has a provoked seizure, such as with alcohol withdrawal or certain medications that increase seizure tendency. Most individuals with recurrent unprovoked seizure are placed on an anti-epileptic drug medication. The specific medication is determined by multiple factors, including the potential adverse effects associated with the medication, the type of seizure disorder the patient is experiencing, any co-medications the patient may be receiving, and other healthcare factors such as the presence of liver or kidney disease and osteoporosis. Typically, a single medication is used, called monotherapy, and the dose is gradually advanced as needed and tolerated. The rationale for the medical therapy is to render the patient seizure-free. Not uncommonly, the doctor will explain to the patient the potential adverse effects associated with the medication. There are 2 major types. One is the idiosyncratic, or so-called allergic reactions, which tend to be very rare but may be severe. These occur independent of any dose the patient is receiving and cannot be easily predicted prior to therapy. If the patient has an allergic reaction to a medication, the medication is often discontinued and another medication is used. Dose-related side effects depend on the dose of the medication the patient is receiving and oftentimes can be managed by reducing the dose of medication the patient is taking. Not uncommonly, the physician will then see the patient back in the office at some point, such as 1 month or 3 months, to reevaluate the initial therapy for the patient's seizure disorder. Bear in mind that the majority of patients are rendered seizure-free on anti-epileptic drug medication, and most studies have suggested that perhaps 2 out of 3 patients are seizure-free with initial medication trials. Subsequent anti-epileptic drug medications may be used if the initial therapy is either ineffective or poorly tolerated. A minority of patients, perhaps 20%, have medically refractory seizures. These individuals will often undergo a comprehensive epilepsy evaluation to include admission to an epilepsy monitoring unit for long-term EEG recordings and maybe additional neuroimaging studies. Appropriate treatment options to be considered in patients with medically refractory seizure disorders might be epilepsy surgery, other anti-epileptic drug medications, or vagus nerve stimulation. Bear in mind that the care and management of patients with seizures must go beyond rendering the patient seizure-free, but allow the patient to become a participating and productive member of our community. Thank you for your attention.